Right, let me pull myself together and speak to Dr. Layla McCay, who's from the NHS Confederation. The NHS Confederation is a membership body that represents over 500 members across health and social care, including hospitals, community and mental health providers and ambulance trusts. So speaking on behalf of a lot of people. Good morning to you.
Good morning.
Good morning. Can I just ask for your reflection on the tragic deaths of those two nurses, Arima Nazreen and Amy O'Rourke, because it's such a stark reminder, isn't it, of the very real risk that not just nurses, but each and every NHS worker are facing at the moment.
Absolutely. I mean, the NHS is a family and we're all in mourning at this devastating time. I think that it's really hard to express the degree of anxiety and sorrow that NHS staff feel about this, but also their absolute commitment to working through this and helping us all. So it's a very, very difficult time, and I'm sure, sadly, that these will not be the only deaths that we hear about from the health and social care system.
We've had so many texts from our listeners, through the week, the past couple of weeks, who have got loved ones working within the healthcare system. And of course, they are, some of them, really, really worried about their family members. But if you're going in every day, we've heard about staff members who are extremely stoic during all of this, but it will be stressful. It will be concerning. We've got no idea how long it's going to last for as well. What kind of support is available for those people on a mental level during this time? Do you know what kind of advice and support that they're getting?
There's been various guidelines that have come out this week to try to understand how best to support staff. Obviously, NHS staff are in the situation of being at the front line of all sorts of difficult situations at all times. So it's not a matter of having to create support systems from scratch. The NHS has all sorts of ways of helping staff be resilient and helping them cope with their challenging situations, but this certainly is an extra challenging situation. So we have quite a range of things which go from understanding how best your teams can really support each other and debrief after challenging things happen, after very, very complicated shifts, etc., ranging all the way to a range of mental health supportive apps have been made freely available to NHS staff so that they're able to use those in different ways to cope with the mental challenges. Everybody reacts to these things in different ways, but it looks like there's quite a range of things in place to try to support them as best they can. I think that also friends and family can play their part in this, of course.
Yeah, we've got no idea whether these deaths were linked in any way to a lack of personal protective equipment, and we don't want to speculate on that at all. But just on that issue, what is the general feeling now? Now we're a few weeks into this crisis. What is the general feeling over how well protected the majority of staff are right now?
I think it has been a challenge which is starting now to resolve. What we were seeing was NHS staff and social care staff really facing a bit of a loss of confidence in whether the supply of the PPE that they felt they needed was actually going to be available to them. There has been this massive, massive effort to resolve these challenges. And over the last week, we have heard that there has been lots and lots and lots of work on this. And in many cases, PPE is now flowing to the places that need it when they need it. Of course, there are still challenges in place, and that is something that they're still working on. But it has been a massive effort. There's a hotline for people who don't have it. There's a military operation in place to distribute it. There's been problems. They're being addressed, and that's just so important because we're sending staff into battle here. They need to know they have the proper protection, and that is going to be one of the top ways of building confidence as people go to work every day. I think it's heartening to know that this has been a challenge and hopefully it's being sorted out.
Okay, hopefully indeed. Can you tell us where we are with the different Nightingale hospitals opening around the country? Because we're pretty clear on the situation in London, Manchester, Birmingham. Where else are they now opening and what kind of timescale are we looking at?
They're opening all around the country now in a sort of staggered way based on the assessment of where the next rise in cases are likely to be, and everybody around the whole country is really keen to make sure that they're prepared with that extra capacity. We're hearing of them in all of the 4 devolved administrations in England, Scotland, Wales and Northern Ireland. We're hearing certainly that Birmingham and Manchester are very much in progress, with quite a range of other ones around the whole country, including in Cardiff, Belfast and Glasgow. There is a huge effort underway to make these hospitals available as quickly as possible. And it's been quite an astounding effort that's really brought together the NHS and the military in an amazing partnership, the likes of which we haven't seen before.
Thank you very much for your time. We appreciate it this morning. Dr. Layla McCay from the NHS Confederation.